What's up, Doc Mike? Today's topic for March 10, 2021. An update on COVID-19 vaccines and variants. Thank you, Johns Hopkins Bloomberg School of Public Health.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call podcast. Although the U.S. just had its first decline in the number of COVID-19 cases and hospitalizations since September, the level of infection is still unbelievably high. We have 2 approved vaccines on the market, but the U.S. is just at the very beginning of distributing vaccines across the country. So we have incredibly high transmission in a population that is still, for the most part, unvaccinated, happening at a time when a new and quite possibly more transmissible variants of SARS-CoV-2 are starting to spread across the U.S. Immunologist Gigi Granval from the Johns Hopkins Center for Health Security is here to give us an update on COVID-19 vaccines and variants at this intersecting moment. So let's start out with the question of, are there concerns that the vaccines we have now could be less effective against the variants?
Sure. I mean, as soon as you hear about the variants, that's your first thought to be concerned about that. Fortunately, the early tests that people have been doing look good, that the variants are still going, the vaccines are still going to be protective against the variants that we've identified.
And do you think that we'll expect to see newer variants popping up, and might those affect immunity from the vaccines that we have now in the future?
Yes, so really every time that a person is infected with the SARS-CoV-2 or really any virus, it's giving an opportunity for the virus to mutate. Even within one person, it's not a uniform set of sequences for the virus. So there's mutations happening all the time. So that's why it's really important that we speed up our vaccination program, because we really want to stop this giving the opportunities to the virus to mutate, and why we want to drive down community spread so that we stop all of this high transmission that's going to lead to more mutations.
And we know that right now, as a precaution, Moderna is developing and testing a new formula that's specifically tailored for one of the new variants. Do you think that other manufacturers will follow suit with a sort of booster shot like this?
Sure. So Pfizer has also indicated that they're going to be doing this. So yeah, I think that this is an open question right now, because we don't know, because we're experiencing this in real time, just how long immunity is going to last after you've been vaccinated to the virus. So it might be that in a couple of years you need a booster shot. It might be that you need to have a booster shot that's more closely aligned with the variants that are more common. So similar to the way that we have different kinds of flu vaccines year to year. It's a different virus, so I don't want to draw the comparison too strongly, but it's definitely something that pharmaceutical companies are going to be looking at.
But it's still important to get as many people vaccinated now as possible with the vaccines that we currently have, right?
Yes, I've gotten lots of questions about, is the vaccine still going to work? Yes, the vaccine still works. If you have the opportunity to get it, go get it. I am waiting for my opportunity. I keep texting my friends, like, if there's any extra, if there's a cancellation, please let me know, because I'll be right there.
And so you've talked before about the importance of, there are 2 doses to the vaccines that are on the market right now, and the importance of getting both of those doses. But is this a time when we might consider stretching the amount of time between the first and second doses, just to get more people vaccinated while these variants are spreading?
Yeah, so I mean, this is a strategy that's being taken in the UK, and different immunologists, different scientists are aligned with that strategy, or sticking with what we know works. I'm on the sticking with what we know works camp, and I think we should just boost vaccine availability and the numbers. And we know that the dose, the regimen that we have right now, have 1 dose and then 3 or 4 weeks later to have the second dose. We know that leads to really good protection. I think we could start looking to see if stretching it out also leads to good protection. That might be a good investment, but I'd like to, for what we know now, to stick with what we know works.
And just like you, I'm also still waiting for my turn to get a vaccine. So, but we know it's going to take some time for these vaccines to roll out and be distributed to everybody who wants them and is able to get them. And there's also going to be a time period where we're going to have to wait for transmission to fall to a level where activities can start to resume again. So, what can we do in the meantime?
Well, this virus, although it's devastating, it's not magic. We do know that that masks work. We know that social distancing works, and so we need to keep doing it. And there are other things that we could do to reduce risks. You can have good air quality, good ventilation, filtered air, HEPA filtered air. You can make sure that you're wearing a good mask, or maybe two masks, like many people are doing now, to wear an N95 and then a cloth mask on top of it. So we do know that barrier protection is really a good thing to do to reduce your personal risks.
Thank you so much, Gigi. We appreciate your time.
Thank you.